I am covering steps 6 and 7, evaluating the course of action and also implementation. So the first action that we're going to review is informed consent. We're going to test these against the test of justice, the test of publicity, and the test of universality. So under the test of justice, regardless of who the client is or what the background is, reviewing the informed consent is a consistent part of policy and should be exercised regularly during meetings to be sure that the client and counselor agree on path of treatment. Under the test of publicity, there would be no conflict if this were revealed to either colleagues or the public at large. And test of universality, this is the first step in client-counselor relationships. That would be a welcome piece of advice to share with colleagues in a similar situation. The next step would be evaluate the course of action, discuss with the patient their treatment plan and how the results of their tests might hinder their progress. The test of justice, given that we're not really told the background of the client's admission, why or how or under what terms, and however, it really doesn't matter what the background is, and that's actually the point of the test of justice, is that we would see how this would affect and how it would be in any circumstance, and whether or not we would treat her different, or whether how we're treating her is how we would treat anybody else. So the response in this is that this is the fair treatment of all clients. Therefore, the course of action does pass the review of justice. The test of publicity, discussing the treatment plan with a client would not cause an issue of publicity. However, not discussing the treatment plan or a client who's unaware of the treatment plan would be an issue of publicity. Test of universality, communicating with the client their treatment plan would be something to advise other colleagues for sure. Evaluate a course of action, establish the site policy to review treatment plan. If a client is impaired upon entry, then treatment plan must be reviewed within the first 2 weeks of admission. Under the term of justice, the new site policy would potentially avoid further issues with other clients who would not be aware of their treatment plans, either due to impairment upon entry or other causes. I spoke to my doctor on Monday, and I can't remember exactly what we talked about. So people forget, and under high stress circumstances, it's certainly logical to review that with them. The test of publicity, there would be no conflict if this were revealed to either colleagues of the public at large, as there's precedence for this in both counseling and medical fields. And we would certainly want to, if we did not communicate these things, there would definitely be an issue. So over communication is always welcome. The test of universality, communicating with the client their treatment plan would be something to advise other colleagues, because we always want to communicate. Implementing the solution. We would meet with the client, perhaps with a senior colleague in the room as well, particularly as a new counselor. That would make me feel better. So I would review the informed consent, review the treatment plan, and then gently and with compassion discuss the treatment plan and how the test results inform the mental health care team, and that information, if the client were to know or have more information along those lines, then it could impede their progress or reverse progress in some circumstances. And then number 2, we would establish a new policy with the center, which provides for review of treatment plans and informed consent periodically with clients, and provides for a required review of treatment plan and informed consent within the first 2 weeks of residence if the client was impaired upon entry. And that's it. Thank you.